Hey, thanks for being here. I'm Josh Elman.
And I'm Bryn Carmen. Colorado is seeing a sharp increase in a drug-resistant bacteria. It's called Shigella and primarily affects your stomach.
Yeah, local health experts, they're showing some concern about this sickness because it's pretty hard to treat. Our Natasha Lynn's alive outside the health department. Natasha, we're trying to learn more about how we can keep our family safe.
Doctors are concerned because the illness is becoming more and more resistant to the 5 most commonly used antibiotics in the U.S. And now it's affecting more adults rather than the younger kids.
According to the Center for Disease Control and Prevention, Colorado now has the second largest number of drug-resistant Shigella cases. Doctors say it could be linked to the high levels of antibiotic use during the pandemic.
We tend to see cases of Shigella every year, but what we're starting to see is that more and more cases are resistant to these frontline antibiotics that providers prescribe for patients. And so what that tells us is that we, as a provider community, need to start looking at pulling susceptibilities, which can allow us to understand which bacteria is resistant to which antibiotic.
According to health experts, Shigella is commonly spread among men who have sex with men, people who travel internationally, and those experiencing homelessness.
We tend to be most concerned with people who live or work in congregate care or congregate housing. So we pay a lot of attention to long-term care facilities, daycare facilities, homeless shelters, things of that nature, because that bacteria, you only need a very small amount to make people sick.
Shigella bacteria spreads through direct person-to-person contact and indirectly through contaminated food and water.
Risk factors for Shigella include international travel to places where Shigella is common, eating food that has been contaminated with Shigella, likely through an ill food handler, contact with someone who has Shigella.
Doctors say symptoms can include nausea, fever, and severe stomach pain. As always, doctors recommend frequent hand washing, cleaning your fruits and vegetables, and being careful while eating out.
Symptoms usually start 1 to 2 days after infection and can last up to a week. And the CDC is holding a webinar tomorrow at noon to provide more information. Reporting live from outside the El Paso County Public Health Department, I'm Natasha Lynn for KRDO News Channel 13.